So cardiac tumors, the most common heart tumor that you're going to see, the source is from metastasis. For example, from breast cancer. However, there are primary cardiac tumors, so that is tumors arising from heart cells. And in adults, the most common one is a myxoma. And in children, the most primary cause is a rhabdomyoma. So let's talk about myxomas real quick. Myxomas usually form a mass in the left atrium, which is in this picture here. This is the whole left atrium, left atrium, left atrium. And what's going to happen in that valve is imagine you have a ball. So that's what I think of the tumor as. You have a ball in your left atrium, and it's going to drop around gravity, and it's going to block that mitral valve. So you can see here, there's the mitral valve. And that, I drew this wrong. Excuse me. Ignore that. This is the left atrium. I need to work on my anatomy, as you can see. This is the valve. You can obstruct the mitral valve, and what's going to happen? You're going to not push blood out of the heart. Blood's not going to go to the brain. And when your brain doesn't get enough blood, it's going to not have oxygen. So it's going to basically do a little shut off. So you're going to get syncope. That's basically losing consciousness. And in histology, what you see in a myxoma is a gelatinous material. This is myxoma cells in a mucopolysaccharide stroma. So it's gelatinous material in histology. The next one is rhabdomyoma. This is a benign tumor with hamartomatous growth on histology. And it's associated with tuberous sclerosis. If you remember, that's from the neural section. And that was it's a skin and neurologic disorder associated with hamartoma. So you get hamartomas in the skin, you get hamartomas in the brain, and you can have also this rhabdomyomas in the heart. So that's it for our cardiac tumors. Pretty simple, pretty easy.